A second healthcare worker at a Texas hospital who provided treatment for Thomas Eric Duncan, the first person diagnosed with Ebola in the US, has tested positive for the virus. Good morning and welcome to the News Hub. I'm Michael Casey. The diagnosis of a second Ebola health worker from Texas Presbyterian Hospital in Dallas is calling into question the lack of training and the breach of protocols that may have occurred. Joining us this morning is WSJ Atlanta Bureau Chief Betsy McKay. Betsy, good morning.
Good morning, Michael.
So my sense is that some people might be concerned that this is a sign that the disease is actually more contagious than feared, or is this something that's more specific to the problems in Dallas?
Well, it seems to be, both yes and no. The CDC and, the Texas State Health Department did warn that because one health worker had been infected, that it was possible that more had been infected, that, there was some event or something about the care or protective gear that, exposed them. And so, unfortunately, what they warned about has happened. A second healthcare worker has been infected. That might help them identify what the problem was. They were trying to, they were doing some very desperate measures that you would do ordinarily in this country to keep someone alive, intubation and dialysis. And one of the concerns is that could have happened. So this is specific to this event. It's not something that is spreading in the community. But the other problem, the real question it raises is how prepared are hospital workers across the country in hospitals that are not specialized for dealing with very serious communicable diseases.
Well, and that brings me to my next question. The CDC is now admitting that they didn't do enough, and they're monitoring 76 healthcare workers in addition to the original 48. What does this say about how the CDC itself has handled the situation?
Well, and there may be more in addition to the 76 since a second healthcare worker has been exposed. They said yesterday, I think they said it well themselves, which is that they wish they had been more proactive in helping with helping this hospital in the first place. I think the realization that everyone has come to is that even if a hospital has the physical facilities to deal with an Ebola patient, they may not have the training. And, they put out guidelines and recommendations, but the question is how well are hospitals able to follow them? So there is a real issue here.
Now, is the Dallas hospital going to be looking after these two nurses now? Should they be moved to a different facility such as Emory in Atlanta?
Well, that's one of the things we have to find out today. It's definitely a question, and it's a question if there are future patients, should they be put in specialty hospitals? We'll find that out. One of the things to note is that this Dallas hospital is in effect being turned into a specialty hospital. The CDC has some of its top infection control and Ebola experts there now. Emory sent 2 nurses to help with it, to help with the situation there. So in terms of people and training, they've got, the best on the ground now. The bigger question will be, should there be a policy of sending Ebola patients wherever they are to specialized facilities to be taken care of? And that's, this situation has really brought that to the fore.
All right, thanks, Betsy, and thanks for all your coverage of this ongoing story.